Have you heard of Ozempic? Okay. Have you heard of Ozempic? Do you know what Ozempic is? You know what Ozempic is? Have you heard of Ozempic? Ozempic is a type 2 diabetes management drug that has been approved by the FDA in the States and Health Canada up here. With the discovery of an unintended side effect, doctors have been prescribing the drug like candy. Let's just say you can lose some unwanted pounds. Everyone in Hollywood is juiced up on the drug. We're talking Amy Schumer, Sophie Turner, Mark Wahlberg, even Oprah Winfrey. Even tech billionaire Elon Musk is on the drug. No, not that drug. But if there are so many benefits, what are the consequences? Why are people not being prescribed it? What's the problem? Well, many doctors say that there are some unintended side effects that may not benefit the users. But why? With me today, I have Dr. Rasul, a family doctor from Stouffville, Ontario. Please, feel free to introduce yourself.
I'm Dr. Zahara Rasul. I am a family physician working at Stouffville Medical Center. I've been practicing in that clinic for almost 14, 15 years now.
Thank you, Dr. Rasul. Would you mind explaining diabetes type 1 and 2?
So basically, as we know that diabetes is a disease where the body can't produce or utilize the insulin that is being produced by the pancreas, right? So there, in general, we have the type 1 and the type 2. The type 1, which is not one of the common ones, usually in 10%, right? So, and then the type 2, which is a 90%.
As mentioned, diabetes is the mismanagement of insulin in the body leading to a glucose imbalance. Normally, when the levels of glucose or sugars in the body become too elevated, an organ called the pancreas produces insulin. Ozempic is only 3 amino acids away from the actual GLP-1 protein and can act in very similar ways. GLP-1 is usually produced in the intestines during digestion and has many functions in the body. One such effect is the action of GLP-1 on the pancreas to increase insulin secretion.
So how would increasing insulin levels help address the issue of type 2 diabetes?
It would definitely help with reducing the blood sugar levels, right? Which ultimately, it will help with the weight reduction. It would help with managing hypoglycemia or hypoglycemia that's there in the blood, for sure. And then in general, it would help with entire control of diabetes altogether.
Having more insulin in the body leads to the insulin going to receptors in the body and acting on the receptors in a greater response. Before, when there were fewer insulin molecules, the chances of a reaction were much lower. But with the new flood of insulin, the chances that insulin binds an active receptor is much higher. GLP-1 molecules also act as allosteric modulators to increase the sensitivity of receptors to insulin. An allosteric modulator binds to the receptor at a different location from the initial ligand and can have some effect. In our case, this makes binding easier and reactions stronger at the initial site. The final effect of Ozempic is on the clearance of food out of the stomach into the intestines. GLP-1 proteins act on the sphincter at the end of the stomach connecting to the intestines and slow the opening of the sphincter. They also reduce the overall diameter, making the clearance slower and increasing feelings of satiety quicker and for longer periods of time. When combined, these three effects create a very effective diabetes drug, but also cause patients to lose weight very easily. In trials, Ozempic has been shown to have many side effects, some of which that have been disclosed include nausea, diarrhea, vomiting, decreased appetite, hypoglycemia, nasopharyngealitis, lipase increases, dyspepsia, back pain, gastroesophageal reflux disorder, upper respiratory tract infection, UTIs, and constipation. Additional side effects that have been reported are gallbladder issues and thyroid issues, such as thyroid cancer. Most crucially, another important side effect is decreased appetite and weight loss in participants.
In 2022, 30% of Canadians were obese and 35% were overweight. That's nearly 1 in 3 Canadians with a BMI of over 30. Between 2015 and 2022, there was an increase in the obesity rates by almost 4%. On its own, obesity is associated with negative health outcomes, but the real detriments come when looking at the comorbidities associated with obesity. Hypertension, type 2 diabetes, heart disease, and sleep apnea are all comorbidities associated with chronic obesity. For decades, scientists have been looking for a drug to combat obesity. Would you prescribe other semaglutide options like Wegovy or Saxenda? Have you seen those at all?
No, I haven't. Yeah, so something like that. I mean, it would be similar anyways, but it would have all the same risks, right? But I think that it would be something to consider on a later basis after considering modifiable factors, actually.
As Dr. Rasool mentioned, neither of these drugs are approved in Canada for usage. In the States, Wegovy has been shown to be better for weight loss than Saxenda, and Saxenda has been shown to be better than Ozempic. Overall, the only differences between these drugs is their dosage schedules. Given all the hesitancy to prescribe semaglutide products, what are some other options for people with type 2 diabetes? Let's check with Dr. Rasool. What will be your first step in treating a patient with type 2 diabetes?
I think as family physicians, when we start off, at least I know for myself, we look at the risk factors that they have, right? And try and work at that. Because initially, anybody who has diabetes, we'd be looking at lifestyle changes, things that are modifiable, right? Lifestyle changes, diet, exercise, all those very important things that go along with that, right? And even after that, when things don't work out, and they haven't really been able to reduce their A1Cs, that's when we have to really think about whether we need to introduce medications, right? So semaglutide products are obviously not the first line. So generally, in general terms, for me, I know I would totally go with the first line, which is usually metformin.
As Dr. Rasool mentioned, the first step is lifestyle changes. Afterwards, there are some medication options such as metformin, which is a biguanide, and arquebus and miglatol, which are alpha-glucoside inhibitors. All three of these medications work to decrease the amount of glucose present within the blood. On top of this, the conjunctive medication cyclosep may be prescribed in order to manage diabetic symptoms in individuals who are exercising. What would make you more likely to prescribe Ozempic?
I think with any of these kind of drugs, right, study times, right, like in terms of how long they're being studied for.
There have been countless articles published and exorbitant media coverage on Ozempic, leading to its relatively widespread recognition. Although most doctors may agree with Dr. Rasool, some doctors in Hollywood are prescribing it to anyone and everyone who asks for it. Given all this, it's clear to see why even though some doctors in Hollywood might be printing prescriptions, most doctors don't see it the same way. Its recent media attention may have propelled it to stardom, but this may not be for the best. When combining some nasty side effects with the fact that there's a lack of thorough evidence, many doctors are hesitant to prescribe it for weight loss. Also, when combining the fact that it's a new kid on the block and the fact that there are some valid alternatives like metformin, we can see why some doctors may even be hesitant to prescribe it for diabetes.